Okay, next up we have, so hopefully Simon, you're mic'd, Ronan. We have Ronan online.
Believe so.
We do?
Yeah,
Oh, there he
yeah,
is.
that's
Fantastic, cool. I was, so anyways, remember I talked a little bit earlier, we heard about some, come on up on stage, Simon, and Elena. Where's Elena? There she is. Fantastic. We heard a little bit about, what are they doing in Europe, right? And I said, well, don't worry, we're going to have somebody from Europe who's got European experience a little later on in today. So now is the time. So really excited. So I got another panel. Welcome both. And online we have Ronan. Can we see Ronan on the screen? Like, is he...
We can see Ronan.
Well, we can see Ronan.
that's all that
There he is.
Yeah,
Fantastic.
I can see you in the
Big
room.
wave, Ronan, to the Canadian crowd here. Fantastic. Okay, so we're looking at innovation panel, right? Scaling innovation in the wider healthcare sector, accelerating while ensuring value for money and fit for public interest, or fit with public interest. And that's where we have a couple of old friends of mine and a new friend again. So Simon Higgins, we knew each other back from my QVIA days. Elena and I still work together quite a bit, CDA with Johnson & Johnson. And then my new friend that I've just met, Ronan O'Kelly, who is assistant principal from the Department of Health in Ireland. So we're going to start off with an introduction. So perhaps if you just introduce yourselves, a little bit of a background, and tell us, your thoughts on this topic.
Sounds good, sounds good. So Simon Higgins, I'm a researcher and consultant with a real interest in diffusion of innovation. Spent about 20 years at Canada Health Infoway, where I led the research, analytics, and performance portfolio. So had the opportunity, the real privilege to sort of observe a variety of programs unfold. Saw some great wins in the Canadian landscape where we saw some real digitization happen over that time, and also a bunch of technology that never quite got off the ground. So this question of what gets off the ground, what doesn't get off the ground, and why is really a great interest to me. And so I'm looking forward to diving into some of those specific sort of technologies and talking about them. But the short version for me is that it's rarely the technology, it's that context. It's the policy environment, it's the funding environment, it's the change support for the people to get it off the ground. And there's so many amazing technologies out there in the Canadian healthcare system that are only used in 5, 10, 15% of the potential use cases that we can explode and get a ton of value out. So lots of opportunity in this space for sure.
Fantastic. Maybe we will flip over now to Ireland, right? And let's hear from Ronan O'Kelly.
Hi everyone in the room. I'm from wet and windy Dublin. My name is Ronan O'Kelly. I work in the Department of Health or Ministry of Health in Ireland. I work on developing digital health policy for Ireland and strategy. I'm also co-chair for the Global Digital Health Policy Environments Workstream, and I've previously worked with Simon on that role. So just from my perspective, I'm just going to give everyone an idea in the room and what we're doing in Ireland in digital health policy. We've really improved in the area in the last couple of years, and we're looking ahead into how we fit into the wider European picture. The European are proceeding with the European Health Data Space, so that's all about creating the primary use and secondary use digital health data infrastructure so that we can leverage of our digital assets, to build innovation across the EU.
Perfect, thank you. And now Elena, and I know you were here last year with
Yes,
me.
absolutely.
We did a fireside chat, and we kind of talked a little bit about partnership, right, between private and public. And but I think that's where you have the privilege, the opportunity, perhaps, or perhaps the challenge of looking at some of these things now in an active role, right, with the CDA. So introduce yourself and tell us a little bit more about you and then your perspective on this topic.
So thanks, Jonathan, for putting together this panel. Excited to be here again, second year. I guess I'm going to be a regular from now. I'm Elena Lungo. I'm the Director of Data Systems and Analytics with Canada's Drug Agency. And the CDA AMC is at the front door of innovation coming into Canada. We are at the receiving end of many of the new therapies that bring improvements in the oncology, in the rare disease space, in drugs specialized in the specialty area. And we are responsible for providing advice to federal, provincial, and territorial drug plans around their reimbursement decisions. So FPTs turn to us for that insight, for that assessment of the value that the technology, the innovation provides. And more and increasingly more recently, some of these drugs do come to Canada with incomplete or developing evidence. There's a push towards faster access for the patients, which require oftentimes these life-saving medications. So we are often challenged to formulate those recommendations when there is a vacuum of information and data from the clinical trials or from the real-world data that we need to rely on. And in a recognition of some of those challenges, 2 years ago, the federal government tasked CDA-AMC with new functions, including data systems and analytics, to help improve data collection and access and the way we use real-world data to inform some of those deliberations. And hence, the data and analytics functions was created, and we are working with partners to collect more data, to make it more readily available, and to allow faster decision-making process.
Perfect, thank you. So we'll start with Canada. So in terms of your experience, Simon, you said you saw a lot of things fail, you saw some successes. Maybe elaborate on that a little bit more, and then perhaps maybe we'll hear from the European perspective.
Absolutely. So maybe I think one of the big successes in Canada was our effort to modernize and digitize primary care. So folks might remember around the year 2000, large portions of advanced countries had largely digitized primary care sectors. Canada had kind of around 15% of our docs using electronic medical records. And so a significant investment over the course of almost 2 decades, really, to get us to the point that now you've got 95% plus of primary care docs using electronic record keeping. So great success, but it took 2 decades, and it took not just technology, but it took a lot of change support and really on-the-ground change support to help people to modernize and integrate those systems. And it took time, and in many cases, it was generational change. I was having some conversations earlier today about this notion that sometimes it actually takes a generation to adopt a new technology because the ways that they're working don't make sense to modernize. So that's the kind of trajectory we've seen in healthcare. And I think the big important question is, how do you shorten that? So what are the sort of policy levers, or the funding levers? What are those change efforts that we could use to shorten that cycle and get technology into the hands of clinicians and patients a lot more quickly than it has thus far? So there's a lot of interesting examples, but maybe I'll leave it at that one, and we can talk about some others.
Yeah, because I'm going to ask Ronan. So did it take 2 decades to get the primary care physicians to adopt EMRs in Europe?
Yeah, it's a challenging area, and I think from Ireland's perspective, we're a small country within the EU. We're a population of 5.5 million out of a population of 450 million, so just over 1%. But the issue in Ireland, while we are one of the fastest growing populations in Europe and one of the youngest, we're actually dealing with a lot of issues now in a really accelerating aging population, and that's putting a lot of challenges in the system. Historically, we probably have invested in physical infrastructures as opposed to the digital infrastructure, and over the last 10 years, we've really seen a kind of realization of that. But from the department's perspective, we've took opportunities presented by the pandemic and a cyber attack we experienced in 2021 to put what Simon was saying there, to put the policy levers in place. That's our Digital for Care strategy. We're also developing legislation to improve interoperability and data sharing across the system, while also leveraging the benefits of the European strategy and the European health database, and how we feed into that to kind of leverage, to build a narrative around providing data to the patient, make the patient the center of our digital health strategy, so that we can bring our funders and bring stakeholders along with us in building that message around the increase of funding. And we've seen that over the last 6 to 7 years in particular. We've seen a year-on-year investment in our digital health infrastructure, and that we feel now that we're really building the case and we're starting to see real results around. Earlier this year, we released a patient app, and we're developing a national shared care record, which is really helping us in, get data back to the patients, which is allowing, opening up potential around secondary use further down the chain.
So I'll turn now to Elena. So thinking about what is that fuel that we throw on the fire, right? And then perhaps, do you see it increasing? So if you think about your current experience, right, within CDA, are things speeding up?
We're certainly trying to, expedite them, because at the end of the day, is really the patients that need access to those life-saving medications. And in the deliberations that the committees are making, oftentimes, there comes the question of, okay, what is the patient population? What is the treatment trajectory? The data is not always there readily available. You oftentimes rely on one expert opinion, so N equals 1, and how much confidence do you have in how representative that piece of information it is? And you have to issue a recommendation. Our performance standards are 180 days. You can't afford to go and collect data and analyze it and make that informed decision. So we're challenged with, and oftentimes we're referring as Canada as being fragmented data. But actually we have, and maybe Ronan can speak to that as well, we have very rich data in Canada. The challenge sometimes is how do we connect it together. And data in itself has zero intrinsic value unless you actually use it. It doesn't really do anything. It just sits there. And I think it was Patricia earlier today who said 97% of the data is not even being used. So imagine a city the size of Toronto with its real estate, housing, and businesses being 97% empty. What a lost opportunity to leverage that capital to make investments that fuel the economy. Healthcare doesn't just improve our lives, it improves the economy. Health spending in Canada, it's almost $400 billion. It's 12.7% of the GDP, one of the highest share in the OECD countries. We spend almost $10,000 per capita on healthcare. So there's a huge capacity and potential to improve productivity there, to realize efficiencies, to do better. As CDA-AMC, a pan-Canadian organization, we really pay attention to what the leaders of this country are saying. Mark Harney made the remarks around federal government intends to invest in nation-building infrastructure. Okay, data and analytics is an infrastructure that has the capacity to fuel our health, our well-being. How are we, leveraging that? What is it exactly? How we can piece together this infrastructure so it's more policy ready to support the needs of the system and the patients?
Yeah, it's funny, one second, but it's just the recent comments, right, about our government, our federal leaders, talking about seeing data as a currency, or data as, as something that's a very tangible thing that we could use and could leverage. You talked about the size of healthcare, and I think that's where, we still, as provincial entities, we talked about that fragmented data system we have earlier, right? How do we demonstrate to the federal government, right, that we are using each dollar responsibly, right? Because the federal government clearly said, listen, we will fund more health care, but before we do that, we want to make sure that you're using the money that we have already given you responsibly and something like that. I know you want to jump in, so go ahead.
So I love this topic of economic value, and I'm so glad you raised it, because I think it's a really important part of the discussion. And Anderson Chuck and Tom Mully at the CIHI put out a piece recently looking at the economic value of data. To me, it's an important story because we've been trying to drive digital health adoption and data analytics just on the business case within the health sector. And made progress, but we're still pushing molasses up a hill in terms of getting the level of infrastructure investment that's really needed to make change. So to me, being able to say, okay, this is about patients and caregivers and making sure we're delivering the best possible care, but it's also about having a thriving life sciences sector. It's also about having a thriving AI sector, and that matters a ton. And so absolutely it makes sense for governments to make large investments because the return on investment shows up in all these different places. And I think that's a message that we need to keep on repeating so that we make sure that that investment happens. Because when we look overall at spend on ICT and analytics in healthcare compared to other industries, in Canada we lag. We spend far less on IT than industries like consulting and banking. So we have a sort of an order of magnitude investment to overcome, and you need an economic argument to really drive that point home.
So perhaps, was that the secret fuel for the fire, Ronan? Tell us about Europe and what was your experience with funding from the government?
Well, how we built our message, Anne, was key, was putting patients at the centre, empowering patients by providing them with their health data. We're progressing legislation that's very much trying to get healthcare providers around the system to ensure that there's no data blocking and data. It's a patient's right that data follows them through the system. And also that we have a clear message around providing our clinicians with the right tools around patient care, and that's something we key focus. One thing there's familiar about, a lack of investment in digital in the past, and Ireland we'd very much see ourselves as potentially a laggard in the EU, but we can see advantages in that as well. We hear other countries coming to us, across healthcare you always hear the phrase, well, we wouldn't start here. But we're, as a small, open, eager country, we're eager to learn from. There's great examples of what's happening across the Canadian provinces and territories. We also have relationships through the OECD around what's happening in other countries, while across the world we're seeing health systems that are very different. A lot of the challenges, particularly in digital health, are the same or very similar.
Yeah, go ahead.
Sure, and no, I really appreciate those points and what Simon said earlier, but I also want to make the comment, because I was struck kind of this morning about kind of the discussions and the innovations that I see are happening. I truly think it's a two-way street. I mean, as part of the data and analytics effort, we are funding CIHI to collect drug data for all people in Canada. Right now, CIHI has a certain portion, but not 100% of it. And now we're realizing, we are in a 3-year agreement, but we're realizing, it's a very ambitious endeavor because collecting data actually takes time. And now I've been there at the outset of NPDUIS 20, 30 years ago. It took a decade to collect all that data. And my question is, does it have to take, so long? I don't think we have, decades to kind of get to this. So when I saw earlier today the amazing efforts that are being made to leverage the data that health authorities have, that care facilities have, to improve the patient experience, the quality of life and care, it's incredible. And everybody seems to be making a concerted effort, a strategic decision to invest in AI, to leverage the data. And my kind of challenge to you really is maybe also make a strategic decision to challenge the perceived barriers in the data access. And I think I made the comment and the question earlier around that kind of vertical integration, because now as we're collaborating and partnering with CIHI, the organization goes off to collect more data. It's a lengthy process. It shouldn't always be such a difficult discussion to have. And I think we have to take a critical look at the data governance structures and legislation and critical view of what we can and what we cannot do to make sure that if we're able to share the data, that will in turn help us. And I'll give the example of, have you ever find yourself in a situation in which you wanted to provide care to a patient and that was just not funded by the government? It's a bit the chicken or the egg. If you're unable to share the data, higher up for those decisions to be relied on actual, evidence, then those decision makers, for them, is difficult to, approve the latest and greatest CAR T treatment for the patients and so on. So I think, it's a bit of a two-way street, and, I'll probably put it again out there, ask not what the data can do for you, but ask also how you can use that data for the greater good. I think, it's almost a public duty to take a critical look at our governance structures and make sure that we actually share that data whenever we can.
I see it on your head, Simon. Do you
Yeah,
wanna-
yeah. Totally agree. And drug data is one of these huge opportunities in Canada, right? Often you might be aware of this. And, when you're talking about starting to get that drug database, you're talking about dispensed drugs. You're not even talking about prescriptions. Prescriptions a decade ago, more than half of them were still written on pieces of paper, incredibly. So we're now at a point in Canada that the majority of prescriptions are now prescribed electronically. There's no reason we shouldn't have a future view of understanding how we're going to make use of that prescription and the dispensed information together to start doing really advanced analytics. But we need that vision for where are we going to get to so that we can plan the steps towards it and get past some of those barriers.
Yeah, well, even on a simple thing like there, with the prescriptions, we know kind of what happens in the community, right? But kind of when it goes into a hospital, it's almost in a black box, right? So again, what's the opportunity? So very interested. It's too bad we don't have Kai Hai up here. Maybe we could next year we could
I
invite
believe
our
our
friends.
colleagues are somewhere in
Yeah, I
the
know they're
room.
here somewhere because I had a great lunch with them
Yeah.
as well too. So we could share some insights there. Ronan, so what was the key factor for success? If you could just nail it, is there a key factor? Is it multiple factors? Because it sounds like you have succeeded to some degree.
I think it's the political buy-in and the realization of, the value of data and the importance of it in the health system in making our, policy decisions, but also opening up data, structured data, to innovators on the ground. The presentation before this was very interesting. I thought it showed the value of combining data and getting real results like that in a healthcare setting and in an acute hospital. Just to go back to Simon's point, I guess at a European level now, we do have our direction set in this area with the European Health Data Space. And, it's quite ambitious legislation. This is the first time we've seen this in Europe, but we're going to have, by the end of a decade, all that information, prescription information, flowing across borders, in an interoperable way. But also, more importantly, and this is probably where the senior policymakers in Europe see the value of the secondary use of data that will allow better decision making, allow increased innovation across the EU, and with the intent of increasing our economic competitiveness on a global level. So that's important context, I think. Yeah.
I'm going to open it up before. Oh, sorry. Do you want to?
I was just going to say, not to be too competitive with Ronan, but European Health Data basically scares me as a Canadian because it positions the Europeans way ahead of the Canadians in terms of a place you would want to go to do things like drug discovery. So to me, there's a call to action. If Europe is modernizing, we need to be close behind so we can keep those businesses here in Canada.
Well, and to the point that Elena made earlier, like the economic spin-off, right, that comes for us being leaders, right, with both data sharing and creating that kind of petri dish when it comes to development and things like that. I'm going to open it up for questions. We got some great minds here. We got some colleagues from Europe. Any questions that we could go to in the audience? If not, I'll start peppering them with more questions. Oh, we got one in the back. If you could introduce yourself again and where you're from.
Sure. I'm Shefali. I'm here with the Data Sciences Institute from University of Toronto. My question is that Ronan actually spoke a couple of times about putting data back in the hands of the patient. Our discussion today has mostly been about how, not from the perspective of the patient, but from the perspective of the care providers. So I'm curious to know if hospitals, federal government, provincial governments are doing more to give data back to patients, because it can be a struggle to get your own data from your primary care doctor or other clinics. Sometimes it takes months and you have to pay to get access to your own personal data.
Interesting. So before you answer that, Ronan, I made an observation. It was funny. I was on a podcast about a year ago asking me about the impacts of AI on it, and I said what it's going to do is get patients more involved in their care. But to your point, I haven't seen that yet, right? And so I think it will happen. I'm still thinking that prediction is going to be right. But Ronan, could you reflect on that? Talk to us a little bit more about the data in the hands of the patient.
Yeah, I guess in Ireland we've kind of come a long way in this. I haven't mentioned the GDPR, which is the data protection regulation on an EU level. So when that came in 2018 in Ireland, it actually caused a lot of problems with data kind of seizing up and people not sharing across the system. So that was something that we've been trying to overcome with our legislation and our strategy, but also the fear of sharing data and even using data, and maybe there'll be issues with data quality. The way we found around that is creating this narrative about getting patient data back to the patient, and it kind of allows the system to think about the value that the issues that they might have and with data across the system, and by getting that back to the patient, surely it's kind of reassuring people that patients kind of expect to have their information now. They have the banking example is always used, where you have your banking information to hand. So why can't you have your health information? And we're seeing more of an expectation of of patients that they should have that data, and we saw that in particular during the COVID-19 pandemic, where people kind of expected that the health system already had this in place. So we're really kind of building on that momentum, but it is a challenge, and there's still, the data in Ireland definitely isn't perfect. But what we're seeing is, by putting the patient at the centre and getting the information back, it's starting up the discussions that we probably want in a policy space, and it feeds into the wider objectives around the EHDS, which is a benefit for us in Ireland as well.
Okay, I think Elena wants to jump in on that, right?
I would probably take a bit from our standpoint, more of a systemic lens to the patient engagement. CDA AMC has a patient community, that advisory committee that participates in our deliberations and are an active group into those deliberations. But also the discussions around data. There's great data literacy across patients. And all decisions should be involving them as well. I know there are great advocates for making data available that supports better care for them.
May I just weigh in with so OECD put out a really neat report a couple of days ago that looks at case studies of countries that have effectively got their patients engaged and viewing their data. And the interesting thing in that case study is they're all policy interventions. Like they're not even talking about the shiny tools, because the shiny tools don't matter. We're talking about giving people a portal into data, like this is 25-year-old technology. But the policy intervention is what's important. How do you set up the sort of rights for people to get their data, encourage and place incentives for providers to actually release that data? Those are the pieces that actually smooth this and make it go.
Yeah. Any other questions? Okay, maybe one last question. I know we're 1 minute over, but it's okay. I get to ask one question. Was there any in partnership with private companies in Europe, Ronan? Or is there any role with private companies?
I can't really talk to the European example on that, but just nationally, the way our health system is set up, we do have a significant private component across primary and secondary care. So we're constant to engage with our private sector and the hospitals who are moving ahead a lot in this area, actually around the delivery of digital for care. But I guess from a national policy standpoint, we really want to stand back and make sure that we have the legislation in place, the right standards, and everyone's playing to the right interoperability roadmap, just to ensure that we don't come across any challenges around sharing data between both the public and private sector. But it's all about partnership in this area, really, depending on how the health systems are structured.
30 seconds or less. Any closing comments? We'll start with Elena.
Sure. I would say, going back to that nation building infrastructure, investing in data and analytics is not a nice to have, it's a must have moving forward.
I might go back to your comment around patients and their role going forward. And to me, patients in this AI world are going to be the wild card. Patients now have more ways to access their information, and they now have tools that they can feed it into. And so where that goes is anybody's guess, but it will be fun to watch.
Final word to our colleague in Europe and in Ireland. Ronan, take us home.
Yeah, I think this is, it's crucial. It's not just nice to have now. We really have to get used to this as, and more pressures come on the health systems across the world. We really have to get the digital right, and I think AI is just going to accelerate that. But good data is key in leveraging this, both AI and any emerging technologies that come down the road.
Perfect. Big round of applause. Thank you.
Thank you.